Did you know that there is a virus that can be lethal than this terrible COVID-19, especially for children? And I made this special video to increase the public awareness of this terrible virus that can potentially kill your children. So if you have an infant or a toddler who is less than the age of 5, please stay tuned. Hi, welcome to another episode of Helping Professional. Today I'm going to skip the introduction because, as you can hear, my voice is not great and I'm ill. My first son was 3 years old. He got sick with runny nose and sore throat about 5 to 6 days ago. And that was right after he started his preschool. And now the entire family got very sick. So my son had a swab and was diagnosed with RSV, and COVID was negative. And I got swabbed, and it was only for COVID-19, which was negative. I didn't get swabbed for RSV, but I assume that that's what I have. Since the COVID pandemic broke out in early 2020, we have made a tremendous improvement in the public awareness of COVID-19 for its treatments and prevention and all. My actual concern is we are letting our guard down against many other traditional viral illnesses such as influenza or RSV. So I'm going to talk more about that. So if you look at this graph here, this is on the CDC website, an RSV case, the numerator data. So this includes across the entire age group. RSV season is usually in winter. So as you can see in 2019, right before the COVID-19 pandemic, the case started picking up in October, November, and peaks in December and January and start climbing down. And as you can see here, actually we did not have any cases. It's almost zero throughout the summer and last winter of 2020. So it was very atypical not having RSV cases at all in winter. Reason that we didn't have a lot of cases last winter is because we had lots of mitigation measures, including mask mandation and social distancing, hand sanitization, school closure, and all those things. And now those are getting relaxed, and we're seeing this surge of cases starting in summer, which is unusual. And now it's picking up already in early September. And look at the case number, it's almost 4,000. That number happened in late November in 2019. And I try to do some research on the mortality rates, comparing RSV with COVID-19. But on the CDC website, the states reporting a pediatric COVID-19 case mortality is up to only 0.03%. So most mortality happens in adult population. This is the article of RSV, and we use this site called Up to Date. You can think of it as an encyclopedia for doctors. And RSV on pediatric population, the mortality was estimated as many as 2.3% of deaths among neonates 0 to 27 days of age, 6.7% of deaths among infants 28 to 364 days of age, so up to 1 year, and 1.6% of deaths among children aged 1 through 4 years of age. Those statistics are used in different contexts, so I don't think we can do this head-to-head comparison. But these statistics suggest that actual mortality of RSV could be much higher than COVID-19. So RSV and COVID-19 have a very similar modes of transmission. So they are transmitted by inhaling virus-containing droplets or having a contact of those droplets to the mucous membrane, such as your eyes, your inside of your nose, or your mouth. The symptoms are also very similar. The RSV symptoms, fever, chills, runny nose, sore throat, feeling ill, fatigue, muscle aches, all those things. And you can have very similar symptoms when you get COVID-19. The symptoms such as diarrhea, vomiting, or loss of smell and taste seem more specific to COVID-19, but there is really no reliable way to tell the difference between COVID-19 and RSV based on symptoms alone. We already have the data suggesting that those mitigation measures that are used to lower the risk of COVID-19 transmission also work against RSV. And my message to all parents out there, if your child is showing any of those viral illness symptoms that I just discussed earlier, please do not send them to school or daycare. The child who transmitted RSV to my oldest son got all of us infected, and then that caused this many days of misery in my family. Also, it is possible that you can get COVID-19, RSV, and flu all at the same time, although it's going to be rare, but it is possible. If that happens, the outcome won't be great. And there is no vaccine available to prevent the transmission of RSV, but we have great vaccines against flu and COVID-19. So if you have not, please go and get vaccinated. Okay, so I guess I will end this video right now because I'm losing my voice. Please, everyone, stay safe and healthy. Thank you for watching this video. I'll see you next time.